Hey, Suzanne here with Caregiver Haven. So, today we're going to talk about what is an emergency. And the reason I do this is because, as a physician assistant who worked in the emergency room, I just saw so many emergencies over the holidays that were really unnecessary. Could they have gone to an urgent care? Probably. Could it have been a wait and watch? Maybe. But these emergencies that we're going to talk about is to help you understand what is an emergency and what is not. And I also have a two-page sheet for you that if you could fill this out and hand it to make a copy of it or take a picture of it and then hand it to the nurse when you get to the emergency room and then hand it again to the doctor, because oftentimes the person sitting at the front desk in the waiting room never sends the piece of paper back to us, the providers in the back. We never see it. It gets lost. So you need to take a copy of it, make a copy of it, or take a photograph of it and make sure the doctor sees it once the patient gets back there. So we're going to talk about all these things and how emergencies really work. And I'll give you some lots of hints on this. Okay, so we want to differentiate between when they just say they're tired, and we want to look at three questions that are going to catch the emergencies. And then I also need to talk to you about the stroke signs, because so many people think, oh, this is a stroke, not necessary, or how do you know if it's really a stroke? And then the holidays, and we're talking about whether it's the Christmas, New Year's, 4th of July, Memorial Day, Labor Day, all this. There's some troublemakers because we get out of our schedules and we forget to check on certain things with ourselves and our seniors. It's a lot like traveling. We get out of rhythm and we don't realize the emergency is creeping up on us. And then we're also going to talk about when to call 911, when to use the urgent care, and when to watch and wait. All right. So let's talk about that phrase, she's just tired or he's just tired. Not necessarily, okay? What you're looking at here is it dehydration? Is it infection? Is it low blood pressure? Medication side effects? Blood sugar swings, especially over the holidays when we're eating cake and ice cream and candy and everything else, or even early heart trouble. Here's the risk that when we label it as some kind of holiday fatigue or travel fatigue, we kind of stop looking, and we're not, even seniors do this to themselves. Oh, I'm just tired. Well, you may be tired, but something else is creeping in here. And sometimes a senior doesn't want to worry anybody, and so they just kind of brush it off and they downplay their symptoms. The red flag isn't the word tired. The red flag is a new tired. What do I mean by new tired? Okay. So when somebody comes in the emergency room and says they're sleeping all day, my next question is, do they sleep all day, all the time? Or is this a new symptom that they're sleeping all the time? Because sleeping all the time isn't good. Something's going on if they're not getting up. Where is their energy? That's what I'm thinking constantly. People who are alive have energy. People who are dying do not have energy. Energy is critical here. So I want to know if they're up, moving around. The other thing is a tired that arrived fast. All of a sudden they're exhausted. They go and lie down and they're not getting up. And then, if any of this tiredness is paired with weakness, confusion, shortness of breath, or chest pressure, or even a fall. Let me say that again. A tiredness that's with weakness, confusion, shortness of breath, chest pressure, or a fall. Something's going on. So if it's sudden, or it's different, or it's paired with one of those things, it's not normal. It's not normal. Okay? So don't don't think about, oh, let's dismiss it. You have to watch how much they're getting. They're lying down, they're sleeping, they're tired after or during any one of these holidays. All right, let's talk about the three questions that prevent panic, and you're going to catch danger. Okay? What has changed? That's the first thing I need. What is different? And again, we're going to refer to this worksheet later on in this presentation. And you get this worksheet and you keep it nearby. And that's all I need. That's the only thing I need in the emergency room is for you to answer those questions. And we'll talk more about that later. But when something feels off, don't chase that diagnosis. Oh, could it be this? Could it be that? I need to know what has changed. Name that change in one sentence. I do not need a story. All I need to know is what has changed. How fast did it change? That's the second question. Did it change in minutes, hours, or days? If it changed in minutes, we got a problem. Then what's new? Is it, have you seen new medications, a new diet, new foods, missed medications, cold medicine, new food as I said, travel, dehydration, a fall, not getting sleep, sleeping somewhere else, not sleeping in their normal bed? Have they been exposed to any illnesses or infections? All right, this is how you're going to stop those are the three questions. Three questions. And no matter whether you call telemedicine and you talk to them, whether it's a trip to the urgent care or the emergency room, all three questions apply here. If you do need urgent care or the ER, this questionnaire, these three questions answered, is going to be your starting point. Really going to help us. All right, let's talk about strokes, because many people think a stroke is all of a sudden their face droops or their arm, they can't move it. That is not always the case. Some people have come in and said they vomited, projectile vomiting, where they're sitting at a restaurant and all of a sudden, bam, their vomit goes over the whole table to the next booth. Okay, that's projectile vomiting. However, what you need to know is it's sometimes not even that. It's dad's just acting weird, or mom is suddenly clumsy. It can be very, very mild, and you don't know. And, we use the FAST, FAST, it's face droop, arm weakness, speech changes, time. T is for time to call 911. And yes, that is nice. But anything that you see anything you see that doesn't sound right. I'll give you a perfect example of this. I was working a rural emergency room in Kentucky, and this man came in, and when we called him back, he carried his wife in, and he hadn't even called the ambulance. He carried his wife in, and she was lying there and she looked over at me. She was awake and she looked over at me, and I could tell that she was not thinking. And I said, how I knew she had a stroke. And when he placed her in bed, and I said, how long has she been like this? He said 3 days. And I thought, and I said to him, why did you bring her in? What made you bring her in today versus the first time you noticed that she wasn't getting up and around? I said, what's she been doing? He said, lying on the couch. And I said, well, why'd you bring her in now? And he said, well, she stopped cooking my meals for me. So that's an example of how long are we going to wait? I know that sounds silly, but how long are we going to wait and watch? With strokes, you can't. If you suspect a stroke, if you suspect that she just had a mild, she forgot where something is, or she's confused on something, you might even see a little agitation at that point. It's enough to get her in and get that, usually a CT scan of the head. All right. Especially if they say something like, I can't find my words right now, or they're mumbling. So families will often wait and they see that she's back to normal again, and they don't realize that she just had a mini stroke, and like earthquakes, mini, 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 and then the major one. So you want to get her in, call 911. You're not going to bother us at all on a stroke. We will always be glad you brought them in. That's how we feel. That's what we're there for, is to help evaluate them. All right, the UTI. So here's another holiday myth that we often see is, again, it's travel over the holidays, it's eating more sugar than we normally do, or it's being out and about and now dehydrated, and then they're confused and it's, oh, it's a UTI. But sudden confusion, even delirium, can be dehydration, a medication side effect, low oxygen. They're not getting enough oxygen, or blood sugar problems, or infection. There's pain, there's constipation, or even that silent stroke that we've already talked about. So we can't just say it's another UTI, even though she might have had 40 UTIs in the past, doesn't mean she has another UTI. And the risk is that we treat, that we're thinking we're going to label her a UTI instead of the real danger that's going on. If the confusion is sudden, especially with a fever, weakness, or trouble breathing, or new sleepiness, or that fall, you can't wait. You can't wait for antibiotics, all right? You've got to get them evaluated immediately. And again, these sudden changes mean 911. They do not mean that you wait around and see what's going on. We have got to figure this out in the ER. Got to figure it out. All right. The next thing is dehydration and this food that we have over the holidays. And notice that I've got a faint glass of water here because what is missing? That water. People don't drink enough water over the holidays. We forget about it. We get out of sync with our normal water drinking that we do every day. They always drink less water, so they could be dehydrated. They're busy, you're traveling, avoiding the bathrooms. We're adding salty food, so we're swelling. And then our blood pressure is going up too. And then sugary treats, maybe even alcohol, plus the common meds like diuretics. And suddenly there's dizziness, there's weakness, there's low blood pressure, there's headaches, there's constipation, there's falls. Here's the real shocker. Dehydration can cause confusion that looks like dementia is worsening. So if you're a senior with mild dementia, or you're a caregiver taking care of somebody with dementia, you think the dementia is getting worse when really it's not. It is the dehydration. And the only way we're going to figure that out is with labs in the ER. Okay? So we can get them back pretty quickly, and we can let you know if it's dehydration. We can let you know if their sugars are off. I will tell you that I have seen people come into the ER brought in by their families. They are totally confused. And this is, 20, 30, 40-year-olds. They're not necessarily seniors. And they come in and they're confused, and the first thing I'm going to do is prick their finger and see what their sugars are. And I've seen sugars 900, 1,000, 1,500, and there's the culprit right there. Okay, so you can't say it's just dementia or their dementia's getting worse. No, 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 no. We have to do these labs and confirm exactly what is going on. Your senior might be lightheaded when they're standing. They might have a dry mouth. They might have dark urine, or they're unusually tired. If they're unusually tired, we have to hydrate. You have to start hydrating them. You don't want to guess on it. You want to know exactly what's going on. The red flag, they stand up and they're dizzy, 911. That's all there is to it, 911. We've got the labs. We can tell you what's going on. All right. So in order to avoid this, maybe just keep that water. Make sure they're drinking that water all the time. 8-ounce glasses a day is ideal. And watch if they're running to the bathroom too, because they should be. We don't want the kidneys to shut down. All right. Then, oh my gosh, medication mix up. I can tell you, it's not only with the holidays that people forget when they took their pills or they're traveling, but this medication mix up is often after a hospital visit because they get new meds and they don't remember if they should take those meds with their old meds, and they don't know what the new meds are doing, and nobody knows anything yet until they follow up with their doctor. And usually when they do get back, when you or your senior get back into the doctor's office, it's 10 days out, you've been taking different medications, and what your doctor has to do is straighten it all out. because it's a mess now, and get you back on the right medications so you're stabilized again. That is why there's so many questions when you get discharged from a hospital. I'm not even going to go into that now, but just medication mistakes. And what, here's the other thing. One person gives you a morning pill, somebody else says, just to be safe, maybe you better take one again. The senior takes cold medicine that clashes with the prescriptions. They're eating food all day long because there's lots of cake and ice cream and picnic stuff going on, especially 4th of July or Labor Day, Memorial Day, and they're eating. And are they supposed to take their meds with food or without food? How long are they supposed to wait? And then they're staying up late at night. Are they eating again? Were they supposed to take foods? All of this stuff leads to falls, confusion, low blood pressure, bleeding risks, heart rhythm issues, and the sleepiness that I keep talking about. So here's a simple rule. For these holidays that are coming up in the next couple of days, or any time of the year there's holidays, one person owns the meds. One person is in charge of the medications. One person. And if it's you, the senior, you might ask somebody to double check for you. I mean that they tell them what you're taking, when you're taking it, and have them double check that you are taking it then. All right? Do do not skip this step, because this is going to drive you to the ER and a costly bill. Next slide is about chest pain. Chest pain is not always chest pain. Seen it 1,000 times. People can have a heart attack in the emergency room, and they come in with the craziest ideas. I'll tell you, that one guy came in and said, "Yeah, I was building a fence and digging post holes for my fence building, and I have pain across my back and my shoulders." He's having a full blown heart attack. Had another guy come in who was vomiting. That's all he was doing, was vomiting. Full blown heart attack. Another guy came in that said, I have a bloated belly, full blown heart attack. So who knows? Who knows? Unless we can rule this out, which the emergency room can do, it's a heart attack. Okay? So it's not necessarily chest pain. The pain can radiate to the jaw, it can radiate to the back, it can make the stomach feel nauseous, it can be shortness of breath, it can be so many different things. It can be a headache. There are so many different things while they're having a full-blown heart attack and you don't know it. So you want to act quickly on that. You want to get them in. So it's not the crushing chest pain where they grab their chest. Oh, no, I wish it was. But oftentimes it's not. So any time you doubt, you're going to call 911. And trust me, ER is open during any holiday. In 4th of July, we're usually busy sewing up blown fingers and, people getting eye injuries due to all the fireworks. Memorial Day is a lot of trip and falling because people are running around at picnic areas, and same with 4th of July, same as Labor Day. And Christmas, you've just got so many food changes, and you've got medication mix-ups. You got belly pain, which again can be a heart attack because of the things that people are eating that they normally don't eat. All right, falls. A fall is never just a fall. I will tell you that. A fall is never just a fall. And what do I mean by that? I have had patients come in the ER. They have shown me their hands and said, look, I braced myself when I fell. I did not hit my head. And then they say, but I have the worst headache of my life. They've hit their head. And you can check their head, you can check their face, their scalp, you can check everything. There's no indication that they hit their head. There's no bleeding, there's no scrapes, there's no bumps, there's no tenderness on their scalp. They hit their head, they die. I've seen it. Sadly, I've seen it. I am telling you, a fall is never just a fall. When you, as a senior, or whether you're a caregiver taking care of a senior, when you fall, you have to be checked out. Or they say things like, well, I hit my head, but I seem fine. If your senior's on blood thinners like Eliquis, warfarin or many things like that, the delayed bleeding can happen. So why am I telling you this? Because I've seen the headache get worse. I've seen the vomiting. I've seen the confusion, the sleepiness, or the behavior changes. The other thing is hip fractures. I have seen people walk into the ER with a hip fracture. And you think, what? How did they walk? They did. They walked in hip fractures. They walked in with broken spines. They have their the adrenaline is so high, they just keep going. Broken ankles, broken feet. It is amazing what people will walk in with. So if you can't bear the weight, if you have severe pain or something looks crooked, just call 911. We want to see you in the ER. We want to take care of you. Any head hit plus blood thinner, it's time to get checked out. So if you or your loved one is on Eliquis or a blood thinner and you fall, you hit your head, it's time for an ER. I'm sorry, but it's time for an ER visit. It's just time for an ER visit. You have to make sure you're not going to bleed internally, because a couple of days later, you won't be around. We've all heard stories like that. That famous actress that said, I'm fine, and she wasn't. Okay, so let's stop guessing. So here's a simple guide. You're going to call 911 if in doubt. And we love your calls. We love to see your patient. We'd rather check them out. Now, one of the things I have to tell you about the emergency room. As an emergency room physician, it was not my job to diagnose and fix your other problems. Okay. For example, one of the main reasons people came into the ER was belly pain. Their belly was bloated. Their belly was a horrible pain, excruciating pain, and they thought they were going to die. They'd never felt anything like that before. Well, when we examine them and we run some tests or we do a x-ray and we see that it is gas, because gas can be extremely painful, what we tend to do is say, okay, it's just gas, you can take some products for that. And again, I'm not going to tell you what those are because this is up to emergency room. I want you in the ER so we can tell you it's serious or it's not. Okay. But I've had patients come in to my practice and say, well, I went to the ER and they did nothing and gave me a $10,000 bill and told me it was gas. Yes, that is what ERs do. ERs are ruling out if you're going to die that day. Okay? That's my job. So every patient that walked through the emergency room that I tended, my question was, is this patient going to die today? Are they going to die today? And before I dismiss them and discharge them, my question was, are they going to die today? My job was to keep you alive. That's what the emergency room does. We are going to keep you alive and we are going to make sure that you don't die. So we are going to rule out all those things that are going to kill you, like a heart attack, shortness of breath, okay, infection, a stroke, all those things. We've got to rule out the things that are going to kill you. And then we can tell you it's gas, or we give you an antibiotic for a foot infection or something like that, if it's not too bad. All right. We're going to rule that out. If it's a hip fracture, we're going to see it or rule it out. All right. So going to back to your doctor with a $10,000 bill and saying the ER didn't do anything. No, we don't fix diabetes. But if you're in ketoacidosis, we've got to fix that, a metabolic disorder. Okay. We got to make sure you're breathing. We got to make sure your heart's working. We got to make sure your kidneys are working. We're going to run all those tests to make sure you don't die that day. That's our job in the ER. All right. So let's look at this. So if there is any 911, stroke signs, severe trouble breathing, chest pressure, and let me talk about this severe trouble breathing, because during COVID, it was terrible because people were coming in waiting too long. They were taking care of everybody else but themselves. And this was a lot on mothers that were doing this. And sadly, we couldn't get the lungs working again. So we don't want to wait. If there is trouble breathing, I don't care if it's anything different. Sometimes in a panic attack, we have trouble breathing or we think we can't breathe. Okay. Still, we need to rule out that it's not a heart attack. We need to rule out that it's not pneumonia. So I want you to, trouble breathing, I don't want you to wait on that. We need to see you. We're happy to see you. We're happy to rule it out for you. Chest pressure with sweating or nausea, fainting, uncontrolled bleeding, severe weakness on one side, a serious fall with a head injury or inability to walk, any of those things, broken bones, anything, back pain. Pain will always bring you into the ER. Those are, if in doubt, 911. All right, let's talk about urgent care. Urgent care is for minor infections. They've just started. Don't wait on minor infections because they don't get better on their own. Mild dehydration without confusion. Stable symptoms that need evaluation, like a possible UTI, without severe confusion. All right, we're looking at the mental status, or without that excess sleepiness. And I've had patients get dragged into the ER that have been carried in, sleeping for days. And guess what? I'm calling 911 because they're going to the ER. Not breathing, they're going 911. I'm calling, they're going to the ER. So minor wounds, something that I just need to sew up real quickly, we can do that in the urgent care. Or non-severe flu-like symptoms. In other words, the person is still talking, okay? Person is still forming regular sentences. A lot of times I'll have people come into the urgent care, and when I go through the exam room, they're lying on the table, they got that green vomit bag, and they can't even speak or lift their head. Something is wrong, seriously wrong with this person. I don't have those right labs to do in the urgent care, so guess what? 911. I got to get them out of here. All right. So watch and wait. I've had people refuse ambulances. I've had them drive themselves to the ER, but I've had to have them sign a thing saying that they refused to go by ambulance because they should not have been driving, or they might be going home, which is even worse. So if your gut says this is different, treat it like it matters. Difference plus fast onset of something that's different is more important than the exact symptom, okay? So this just tells you when to wait. Now let's talk about wait and watch for a minute, because what I want to do here is wait and watch. When you call telemedicine, you're going to get a nurse, or you're going to get somebody on the other line that's supposed to tell you something. Now, you've got to tell them the stuff in this worksheet. You cannot, and we'll go over that in a second here, the worksheet, okay? You cannot go on and on and on about something, okay, they fell and I don't know. You know, the worse you make it, which if it's valid, they're going to tell you to go to the ER, not the urgent care. They're going to tell you to go to the ER. So you want to answer these 6 things for them. Be matter of fact. They will start asking you questions after that. So if you could give me these 6 answers, then I can start asking you questions, because in my mind, I am doing a mental gymnastics and I am jumping over what's important and what's not important. And I'm asking you questions to lead me down one path or back me up out of that pathway I'm going for a diagnosis and down into another pathway. And these pathways are leading me to what I need to order and what I don't need to order. This is what every emergency room doctor does. It's what every urgent care doctor does. It's what every family practice, every single doctor who's trained in medicine does this. They're not looking at how comfortable you are. We are not looking at if you're cold or, well, if you need a pillow. Okay, we're not looking at that. We are looking at what is going on with you. And the minute you give us the answers to these questions, Then we can start traveling down the different pathways. And sometimes I've had 8 pathways I'm working on all at once, trying to figure out the diagnosis and figuring it out quick. Okay. And then I can start ordering things and stabilize these patients, the patient, so I can get them where they need to be. So most people, when they I need to know what normal looks like. I need to know. I need to know if they have dementia. I need to know who I need to be talking to if they have dementia or confusion. So so many people come in, they're confused, or they read me a story that's absolutely beautiful and tell me how wonderful everything is, and they really don't want to be there. And I look at the family member, and they're shaking their head like, we don't know who this is at all. So that's the kind of things that change. So get this, keep it handy, make copies of it, start filling it out. All right. So what we learned today is um, what's just tired is not always tired. 3 questions I talked to you about, but these other things on this worksheet I need you to talk about too. Um, Stroke, not always a stroke, because they can just forget their words. The troublemakers, the water, the food, the lack of sleep, the confusion, the travel, the falls, the medication changes, the dehydration, and then if in doubt, just call 911. If in doubt, just call 911. If you want to call a nurse first and talk to them and give them this information, again, 99% of the time they tell you to go to the ER. Could you go to the urgent care? Maybe. But if you come to the urgent care, we can evaluate and tell you they need to go to the um, emergency room. We can direct you there. So I hope this helps. I hope you keep your seniors safe. And seniors, I hope you stay safe during the holidays, because just like traveling, just like anytime we upset our schedule, whether it's holiday or vacation or a death in the family, a wedding, um, something that changes our routine, we have to get back to normal. So you have to know what normal is. I think that's the take home message here. What is normal? So take care. We'll talk soon, and stay safe. Bye bye.